let's understand everything about tuberculosis treatment. So first of all, how long does the treatment usually take? So the standard treatment is 6 months. But if there is drug-resistant TB, then it can go up to 18 to 24 months. So basically, we will use some powerful anti-TB drugs. These are called first-line drugs. There are 4 main ones: Isoniazid, Rifampicin, Pyrazinamide, and Ethambutol. So Isoniazid is also known as Rifampicin, is also known as Pyrazinamide is Z, and Ethambutol is E. Alright, so these are the 4 first-line drugs that we will be using. Okay, so what is the treatment phase? So the treatment has 2 phases. One is called intensive phase and the other one is called continuation phase. So in the intensive phase, which is the first 2 months, we will use all the 4 drugs, that is HRZE. That means Isoniazid, Rifampicin, Pyrazinamide, and Ethambutol. We'll use all these for medicines every day, and the purpose of this intensive phase is to kill most of the TB bacteria quickly. Okay? Because we want to reduce the number of bacteria as soon as possible. So once we do that, the next step is called continuation phase. In this phase, we will continue with the treatment for the next 4 months. But now we will not use all the 4 drugs. We will only use 2 of the 4 drugs, that is H and R. So H stands for Isoniazid and R stands for Rifampicin. So we will be taking these 2 medicines every day for the next 4 months. Okay, and by the end of the 6 months, most of the patients will become infectious. That means they will not be able to transmit the disease to others. But still, we have to continue treatment for the next 4 months because if we stop earlier, then there is a high chance that the bacteria will start multiplying again and the patient will relapse. That means the symptoms will come back. So this is why we have to continue the treatment for 6 months. But if the bacteria are resistant to these standard drugs, then what will happen is that your doctor will prescribe you second-line medicines. Now, these second-line medicines are also strong, but their side effects are more and the treatment will be longer. For example, the duration of treatment may go up to 18 to 24 months, and the second-line drugs include Kanamycin, Amikacin, Capreomycin, Linezolid, Bedaquiline, and Delamanid. So all these second-line drugs can be used if the TB bacteria are resistant to the standard drugs. And these are called as MDR-TB, or multi-drug resistant TB, or XDR-TB, or extensively drug-resistant TB. Okay, so this was about the medicines. Now let's talk about supportive care. What kind of lifestyle changes you should make while you're on anti-TB treatment? So here are the things you need to know. No. 1. Eat a healthy, high-protein diet. Why protein? Because TB mainly affects the lungs and it causes a lot of damage. So you need to repair that damage. You need to build new lung tissues. And for that, you need protein. Good sources of protein include milk, eggs, meat, chicken, fish, fruits, vegetables, etc. Okay? No. 2. Take enough rest and sleep. This is also very important because TB weakens your immune system. At the same time, your body will be fighting the infection, so you need enough energy for that. And for that, you need to take good rest and sleep. Okay, no 3. Avoid smoking and alcohol. Smoking and alcohol weakens your immune system. And remember, your immune system is already weak because of TB, so you should completely avoid alcohol and smoking. And one more thing, if you have HIV, then you should also avoid alcohol and smoking. Okay? And then tell your family members about the disease because TB spreads through air when a person coughs or sneezes. So your family members should also be screened for TB. Alright, so these were the things you need to know about the treatment. Now let's talk about the important points. There are 3 important points that you should always remember. No. 1. Never stop TB medicines in between. This is very important. Otherwise, the bacteria will become resistant, and then it will be difficult to treat TB, okay? No. 2. Always take treatment under a doctor's supervision. So there is a program called DOTS program. That means Directly Observed Treatment Short Course. Okay, so your doctor will make sure that you complete the full course of treatment, and he will also make sure that you don't miss any dose. And third, the BCG vaccine in childhood helps prevent TB. But remember, it does not prevent adults from getting TB. So even if you have taken the BCG vaccine, you can still get TB. Alright, so this was all about tuberculosis treatment. I hope you found this useful. Please like and share this video with your friends and family. Thank you